Good morning, Dr. Patel.
Good morning, Emma. How are you?
It's nice to be with you again this morning. And, I've been out talking to a lot of folks who suffer from osteoarthritis of the knee, and they've been asking me a lot of questions
Mhm.
around, what's the difference with what you do with GAE, genicular artery embolization, and some of the treatments that they're going through. But for the viewers today, can you recap again what is osteoarthritis of the knee?
Sure, Emma. Osteoarthritis is a common condition, and it's worldwide. Its effects. It's sort of the number one cause of disability in a lot of people. It usually starts between the age of 50 and 60, and it's equally common in both men and women. And it's basically wear and tear of the joint, and also inflammation of the joint. So, there's a lot of treatment options available regarding the stage of the disease, which phase of the disease they're in, either in the early stages or late stages. And also the acute flare-up phase compared to a chronic long-term disability producing arthritis as well. So depending on which phase they are, treatment options are different.
So some of the people I'm meeting, there are probably 65 plus.
Mm-hmm.
I'm interested in the fact that you said it's from 50 on the onset of osteoarthritis of the knees from 50. So the 65-year-olds, they're some of them being told that they need knee replacement surgery. And it really is quite scary for them.
Yes.
And so some of them are getting some injections, like cortisone injections. What's your view on that?
Sure. And like I said, it depends on the stage of their disease. Someone with a mild form of osteoarthritis, something like home therapy, such as, ice pack, elevating the leg, or taking some mild medications such as aspirin or Advil, that can be enough for them. But somebody in the extreme phase of arthritis, severe form, where they have such as bone on bone, then the gold therapy is a knee replacement for those patients. But problem with that is a lot of patients don't want surgery, or a lot of patients are not candidate for surgery, because of their weight or because of other comorbidities such as diabetes, because they have a higher risk if they go under knee replacement, these patients. So those patients specifically, GA would be a good option for them. Also, candidates who have tried injections. There are different types of injections, as you know. There's steroid injections, there's PRP injections, there is what people call it as gel injection. There's also like stem cell injections. So these have been clinically tried, but there's a lot of placebo effect too with these injections, because they have studies that show that comparing patients with steroid injection with like normal saline injection in their joint. And so comparing these two. So there's one study out that it was published in JAMA in 2017 that showed that they compared the two arms, steroid injection versus just normal saline, which is just water injection in their joint. And they followed these patients over 6 months' time. And 64% of the patients who got the steroid injection got benefit, and 50% of the patients who got saline injection got benefit. So there is some placebo effect of just from the injection. But in the long term, the steroid injection can cause more damage to your cartilage, which can lead to earlier intervention, such as knee replacement. So long-term studies are there now for steroid injections. That said, steroid injection does help initially for the acute, pain, but in the long term, it can be harmful for your joint. GAE, on the other hand, there's no major side effects to this procedure. It's a, outpatient procedure, same day procedure. You come in, the procedure takes about a half an hour to 45 minutes. We watch you for an hour and you go home the same day. And next day you're back on your feet, doing your routine activity. So it's relatively safe. There's still more data coming out comparing different types of treatment options, which will in the future include GAE as an option as well.
So pretty much anyone can drive in, maybe get a family member to drive them in for the procedure and it's the same day. The recovery would they need to stay overnight near your facility, or can they just go home?
No, they go home. It's done in our office. It's not in the
Right,
hospital.
right,
Just like, you go for a knee injection in your doctor's office, you come to our office for this procedure.
right,
A lot of it, we sedate you a little bit. It's like a conscious sedation, just for anxiety purpose.
sure,
Because most of the time people get knee injection, which is like a quick, 30-second procedure. So they don't have the anxiety. This procedure takes, like I said, half an hour. So people have slight anxiety. So because of that, we give sedation, but it's not painful at all.
and there's no incision.
There's no incision. It just, if you look at the background of how the GA works, is that we know now that, arthritis is not only from wear and tear of the joint, but it's also from the inflammation of the joint. That's why patients get pain, because of the inflammation. That's why they take anti-inflammatories such as
Right,
Advil. They also get swelling in their knee joint and limits their, functionality. All that is due to inflammation. So the inflammation happens because you get release of all these inflammatory cells into the joint through the blood vessels.
mm,
What we're essentially doing is targeting these blood vessels that release these cells into the joint, which causes pain as well as damage to the cartilage. And we block off these blood vessels with tiny, tiny particles. They're almost the size of a, grain of sand. And we plug these arteries up with these particles from the inside. And therefore, you don't get the release of the inflammatory cells into your joint. Therefore, you
right,
don't get the inflammation, you don't get the pain, and also you don't, further progression of your disease by not damaging your cartilage anymore. So there's a
right,
lot of benefits, and some of these patients can avoid having knee replacement as well down the road.
right.
Uh, so it's a great procedure, and it's very minimally invasive, and the effects are long-term as well. Studies have shown that these patients have reduced pain and increase in their mobility immediately, and extending up to 2 to 3 years time, and no
Interesting.
longer requiring any more injections or any pain meds for the
But
arthritis.
I think what's interesting also from your earlier comment is that diabetics, the recovery period after knee replacement surgery, I would imagine would be quite severe.
Yes, with diabetics, with their A1C, I had a patient last week. Her A1C was 10, and she was told that she cannot have knee replacement until her A1C comes down. Meaning controlling her blood sugar. And a lot of these patients, they have acute pain in their knee, and then they're waiting to control their diabetes. It just doesn't happen,
Right,
and they're struggling and they're suffering. So GAE doesn't have those requirements. I mean, if your A1C is 10, that's fine because it's minimally invasive. You can still have this procedure.
yeah,
If you're overweight, you don't need to lose weight to have this procedure, unlike knee replacement. So it covers a lot of broad spectrum of patients who have, who are not candidate for knee replacement, or who do not want knee replacement because they can't take the time off to get physical therapy after the knee replacement, because some of these patients will need physical therapy for a month or 2
right,
months
right.
after knee replacement, and people can't take that time off, and so this is a great option for patients. I highly recommend you patients contact our office, and we can go through the screening process and see if you're a candidate.
That's awesome. What is that? What is your contact number? And can they go on the website?
Sure. Our website is www.avavascular, all one word,
Mhm.
.com, avavascular.com. We're located in Marietta, California, and our phone number, you can also, easy to remember, is 1-833 leg cramp. That's 1-833 leg cramp, LEGCRAMP. That's our phone number.
Well, thank you so much, Dr. Patel. I look forward to the next recording with you. It's certainly helping a lot of people understand their options with GAE. So I'll see you very soon.
Thank you,
Thank
Emma. Have a
thank you.
great day.